What should you understand about spinal fusion surgery? Spinal fusion offers a surgical treatment response to scoliosis, but the reality is that all cases of scoliosis require surgical treatment. Scoliosis involves the development of an unnatural sideways bending curvature that also rotates into the concavity. Since we know scoliosis is a progressive condition, the goal of spinal fusion first is to stop progression. Spinal fusion involves fusing the curvature's most tilted vertebra into one solid bone, eliminating movement of the spine in sacrifice for greater alignment. This is how they try to stop progression. These fused bones are normally attached with rods and screws to hold it in place. There's also bone grafts that are done when they remove the intervertebral disks. They put bone grafts in between the bones for the bone grafts to take in place. So while the bones are actually fusing, the rods and screws are actually holding the spine in position. Now, intervertebral disks are a key component to the spine's overall health and function. They sit in between each pair of vertebrae. The discs provide the spine with its structure because they're in between the two vertebrae, and these discs are like shock absorbers. The discs also combine to facilitate the forces to spread evenly throughout the spine and also to facilitate movement and flexibility. But since they're using screws and hardware to fuse the spine, they eliminate the discs to fuse the spine together because this area is no longer moving. We know that these discs help prevent degeneration and help prevent friction that stops degeneration to occur to the vertebra and bones themselves. However, when the spine starts to deteriorate, very often the discs are the very first structures that are affected because how they're involved with the spinal alignment and movement. Now, one of the positive effects of spinal fusion is that scoliosis, particularly in severe cases, it can try to stop curves from progressing during these rapid phases of progressive stages, especially during growth. And many patients, especially kids, immediately when they have their spinal fusion, after they go through their 6 months or so of recovery, can normally go back to leading their lives that they had led before. However, these fusions also come at an expense. And one of the negative effects or negative things regarding spinal fusion is that it is a very costly, lengthy, and it's an invasive surgery. Spinal fusion definitely has risks associated with it, just with the procedure itself. The potential negative effects can affect the long-term spinal health and function, and there's also risks associated with just having a severe surgery or a significant surgery, like blood loss, infection, nerve damage, adverse reactions to the hardware that's actually used. Other negative effects could be just functional things. We know spinal fusion is a non-functional approach, meaning it's sacrificing the movement-based or the function that's movement-based of the spine, and they're sacrificing that movement with alignment by fusing it together and holding the spine in place through artificial means. It's contrary to the natural spinal design, which is a movement-based design. Many patients can experience a significant loss in spinal flexibility and range of motion, which can be disappointing and disruptive to health and well-being. A fused spine also could be more weak or more prone to injury, especially when there's trauma involved. And some patients find they may have increased back pain and they can have more discomfort as a result of the spinal fusion. And also what we don't know is, considering that most of these surgeries are done in young children, 12, 14, 15 years of age, what happens 20, 30, 40 years with a fused spine, and how do these patients compare to patients who haven't had surgery? And this question we don't really have answered. So when we know that there are cases that potentially may need spinal fusion, we know many cases of scoliosis, especially if they're treated in early stages, can eliminate the risk of spinal fusion by reducing the scoliosis and treating the curve conservatively, because we know the risks associated with spinal fusion are very real and they're very significant, and there's very many things that you can't change when it comes to spinal fusion. I mean, once you have fusion, you can't go back. You can't unfuse it and make it flexible again. Once it's fused, it's fused. So there's never treatment guarantees with spinal fusion or even conservative treatments, but we know conservative treatments are less invasive, so therefore it makes sense that you would exhaust all conservative treatments first before you do something that's unreversible like spinal fusion. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.